suffered from Lyme's disease, and she struggled to sing. And now it's great to see her getting back at it again, getting her confidence back, and rocking the shows in Las Vegas.
You know, they would know what's going on here, here, here. So, and you can't expect people to, you look okay. I was screaming in pain, the headaches. It was just amazing. So I thought, this is the end. I can't work. Luckily, I had a great team to help me out in the Wiggles. It's like a family. So on stage, because I couldn't lift up a guitar, my left side was so weak, they'd have a guitar on a stand set, and all I have to do was stand behind it. Crazy things like that. I function with a lot of help from my condition has led to me having depression and really serious depression over the years. You kind of feel a bit like you're going crazy because you've got a chronic disease, well, you don't even know you have at the time. You don't know what's going on. When someone suggested to me, I had no idea what they were talking about. I heard that it was not happening in Australia, and I started researching and trying to learn more and more about what Lyme disease is and how do you get a diagnosis, which is pretty impossible in Australia.
Adam's a medical outcast.
At some stage, somebody in an office behind me will actually acknowledge the existence of this disease and will allow us to treat patients without threat of persecution or scrutiny or audit.
A year after speaking his mind at this Brisbane protest, the medical board has caught up with Dr. Laddams, effectively banning him from treating Lyme disease patients. Patients like Gianna Teresi.
If I stop treatment now, I don't want to think about that.
Gianna was a healthy, high-flying executive until a tick bite paralysed her 3 years ago.
Our GP just didn't know what to do. Had never seen anything like it before. Told us to go straight to emergency.
For 18 months, Gianna was under psychiatric care, doctors telling her her illness was in her head. Finally, she was diagnosed with Lyme disease.
We noticed changes immediately. As soon as we came under the care of a doctor that knew what he was doing, we saw immediate changes.
Lyme disease is a bacterial infection caused by ticks.
Dr. Peter Main says he's successfully treated hundreds of patients. He's so fed up, he's formed a breakaway group of GPs to try to stop the witch hunt and have Lyme disease formally recognised in Australia.
It's the infectious disease doctors that are the problem.
Janet had to take her daughter Tiffany overseas to have her diagnosed.
Is it just because it's called Lyme? Would you like me to change it to butterflies? Would it make any difference? You know, it's obvious people are ill and nothing's being done about it.
Janet and Tiffany would travel from Melbourne to see Dr. Laddams on the Sunshine Coast. But now,
I don't know where that will leave me. I think I'll lose her. I've seen how she is and I just get really scared.
Lyme disease is a big problem around here. I thought I knew all about it. I taught my kids to check for ticks. But last spring, I picked up Lyme disease. I couldn't prevent it then, but now you could. Introducing Limerix. Now that there's Limerix, I'm making sure my family gets treated. That'll make me feel better.
That was actually.
And when we talk about ticks, how many different types of ticks are they, and can they all cause these problems?
Well, there are dozens of ticks in Australia, many of them imported and not native to Australia.
And to hear that, and I'm sorry your daughter's been sick for so long, but it's probably not Lyme disease, to be quite honest, unless she's travelled overseas to a Lyme endemic area.
Call it what you want. It's a bacteria that's in her system. We don't call it Lyme.
Well, there are things in ticks that...
And when we talk about ticks, how many different types of ticks are there, and can they all cause these problems?
Well, there are dozens of ticks in Australia, many of them imported and not native to Australia.
With ticks, but we're saying you almost certainly haven't got Lyme disease because all the studies that have been done, there have now been 4 large studies done over the last 20 years looking at many, many ticks in Australia, thousands of ticks, and none of them have found Lyme disease bacteria in the ticks.
You've had doctors tell you you've got Lyme disease, right?
I've had doctors tell me that I have a Lyme-like disease, and I agree completely. I think that there is a disease that is out there that is Lyme-like. It has similar symptoms to Lyme. It has similar features to Lyme, and I think some of the co-infections are probably there as well.
Okay, so there's agreement then, because this is a ferocious debate around Lyme disease.
Using the term Lyme-like actually has inhibited the studies because it's made people focus on looking for this organism which we know is not present in Australia. There may be other organisms, but we haven't been looking at them because
and when we talk about ticks, how many different types of ticks are there, and can they all cause these problems?
Well, there are dozens of ticks in Australia, many of them imported and not native to Australia.
Turn a blind eye to it all. Desperate, she left Perth and headed for Bali for an intensive 10-week detox treatment. The Lyme doesn't like the treatment that it's getting, so you're breaking down the bacteria of Lyme, and then what that does is it causes the Lyme to release off bad toxins, which then makes you sick. It also made her better. I was able to walk around without any sort of pain. I was actually able to start reading again.
If it's caught early and treated with antibiotics, it's a very easy disease to treat.
In force, with vets reporting an increase in cases of paralysis ticks. It comes as new research helps predict when peak seasons start and how bad the season will be.
Queensland researchers finding while paralysis ticks are around all year, the timing of the peak season all depends on the weather. Starting in the warmer Cairns climate from early August, in South Queensland it's late August. Sydney's northern beaches a hotspot from the start of October, with warmth also determining how bad the season will be.
If it's hot and dry, the larvae and the eggs will die. And in December, then we don't have many ticks around to bite animals in the September, October, November of that year.
The expert advice is to use preventative medication.
Dr. McManus, can I just ask, why is it that Australia still does not officially recognise Lyme disease?
And when we talk about ticks, how many different types of ticks are there, and can they all cause these problems?
Well, there are dozens of ticks in Australia, many of them imported and not native to Australia. But
recommendation, head to carlmcmanus.org.au. We reached out to the Minister for Health's office for comment, and they provided us with this statement on behalf of Greg Hunt. Diagnosis of Lyme disease is a matter for individual doctors. However, the Australian government has taken 3 overarching, strong, strategic steps to improve treatment for patients and address the underlying causes of illness attributed to Lyme disease and Lyme-like diseases. The steps in particular aim to provide better patient care for people in need. You can read the full statement on our website. At least they're acknowledging it's a step in the right direction, isn't it?
Here at the Hemp Expo, just bringing awareness to Lyme disease and tick-related illnesses. I know that it's a cause that isn't very well recognised in Australia, and it's really, really common. I live in the bush, in a rural area, and ticks are very, very common there, especially with importing and exporting. We get a lot of different things happening now, and people can get all different sorts of adverse reactions to ticks, and the symptoms for Lyme disease are there's a long, long list of a very, very different range of symptoms, so it's really unpredictable and difficult for people with the disease to get the help that they need. So let's bring awareness to the cause, guys.